Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You get up in the morning, take a step, and it's painful. Go up and down the stairs, ouch, it hurts. Knee pain can be caused by an injury, overuse, or an underlying medical condition such as arthritis. How do you treat knee pain? Joining us is Dr. Jeffrey Wilde. He is an orthopedic surgeon at Scripps Clinic in La Jolla, California. Thanks so much for being with us, Dr. Wilde.
Thanks for having me.
Sure. So talk a little bit more about what causes knee pain, and you can, if you have show us a model of the knee if you want to explain.
Sure. Yeah, as you already alluded to, one of the most common causes of knee pain is arthritis. 60 to 70% of people suffer from arthritis, and what arthritis does is here's a model of the knee, and between the femur and the tibia here, you can see there's a bearing surface, tough to see on here, but basically that bearing wears out. And as that wears out, that causes pain. And oftentimes, as simple as getting up in the morning can cause you pain, and walking exacerbate it. So probably most folks are struggling with a condition similar to that.
Okay. What other causes for knee pain?
Some other major causes, bursitis. You can get pain on the front of the knee here from bursitis. Also the meniscus, that's a common thing people hear about, is a cushion, a shock absorber between the two bones. That can tear or wear out as we age as well. And those tend to be pretty common causes. And then something as simple as overuse. You used your knee a lot the day before, and the knee is now swollen, painful, and sometimes that will resolve on its own. But any number of things can cause knee pain, and sometimes a simple x-ray and examination can help sort out for you what's going on.
So how do you treat knee pain?
Again, depends on the variety, what condition you're facing. It may be as simple as some Tylenol and ibuprofen and some ice and rest. Other things to consider is some low impact exercise. So bicycling, swimming are great. It can lessen the force on the knee and make it less painful. A step up from that can be injections. Cortisone is a hallmark injection we do, and about 95% of people see some relief from that, and it can be prolonged for many months. Other types of injections include hyaluronic acid injections, so the gel shots people hear about. That's another opportunity to help manage the pain. Other things like stem cells and PRP haven't played as large a role in the knee, although some people have tried them. Not a lot of data to support those at this time. So we're usually using cortisone and gel shots, but they can help quite a bit.
And what does PRP stand for?
PRP it's platelet-rich protein. And so what they do is they actually take some of your blood and spin it down and then re-inject it into the location of pain. The idea is that there's some healing factors associated with that, and it's had some promising data in several areas of the body, and we're still looking at it in the knee as far as arthritis goes. But it's certainly a safe modality to do, and it's an option out there to try.
Do these injections, are they painful?
Pretty short-lived pain. So most of them we use some numbing medicine, which kicks in a minute or two, and most injections take about 5 seconds, and so it's done pretty quick. The first day or two might be a little sore just from a little bit of swelling feeling in the knee, and oftentimes ice and a little bit of rest can modify that. And then once the cortisone or the gel or what other agent you're using kicks in, oftentimes the pain improves significantly.
And what's the success rate of these knee injections?
Pretty good percentage of people get significant improvement. In cortisone particularly, 90 to 95% of people will see some degree of improvement, and often profound. Gel shots, it's a little bit more variable, but the benefit is they tend to last quite a bit longer when they do work. And similar with PRP or stem cells, if you elect to go that route.
So how long do these knee injections last?
So cortisone shots can, typically if we get a 3 to 4 month response, that's pretty good. You can get them up to 4 times a year. Similar gel shots, we're looking more for a 5 to 6 month response, and those are a 2 time a year shot. You can use both of them staggered, and so between the two of them, oftentimes we're getting quite a bit of relief for many months.
How do you know when you need a knee replacement?
It's a good question. So We do need to see a fair amount of arthritis on an x-ray. So when you hear the term bone on bone, that typically refers to that cushion between the bones being gone, and we see that on an x-ray. And when folks have that and their symptoms get pretty significant, despite us doing these other things we've talked about, then it's time to consider a joint replacement. And in those folks, joint replacements can make a significant difference.
So can you show us what is a knee replacement, the difference between a partial and a total knee replacement?
Absolutely. So the model here I have represents a total knee replacement. I took the kneecap off so that you can see it a little bit better. From the side here, there's this metal cap on the thigh bone, and then there's a plate here on the shin bone with a plastic liner in between. There would also be a plastic button on the kneecap in the front. This is a total knee replacement, so it replaces the whole bearing surface in the knee. A partial knee replacement, I don't have a model here, but as you imagine, think of the knee in three compartments. There's one here, one on this side, and then the kneecap. A partial will replace one of those compartments. And so for people that have the rest of the knee that's in good condition, you could be a candidate for a partial knee replacement. And if the knee shows arthritis throughout the whole entirety of the knee or a significant part, then a total knee replacement is what we would be looking at.
And what's the downtime for a knee replacement, the partial and the total?
So we try to get you up and walk the day of surgery. Most folks only stay one night in the hospital or even go home same day, depending on your health status. And so people are weaning walking aids over the course of a week or two. And hopefully by about 3 or 4 weeks, people are pretty independent. Now there is some therapy involved, which the specific length of time really depends on the person and where your starting point is. But folks are starting to walk right away, and then we kind of progress from there. So, we unrestrict you at 3 months just to allow a lot of healing time, but people are pretty darn functional prior to that.
When you talk to your patients who are having these issues with their knees, what are your final thoughts when you talk to them about knee injections versus knee surgery?
So ultimately, I'm looking for a quality of life when I'm treating people. And so most of the conversation I have is trying to determine what's important to the patient and what quality of life they're trying to get back to. And I try to help them make decisions on the least risky treatments that will help them obtain that quality of life first. And then we progressively increase our treatment strategy from there, depending on their needs and their pain relief. And so a lot of my conversation will be targeting what's important to patients, and it's important for me to hear what their lifestyle is and what they're looking to get back that they've lost as part of their pain. I just want to let people know that if you're struggling with knee pain, there's a lot of options out there. Our goal is to get people back to an active lifestyle, particularly in San Diego here, where people live a very functional, active lifestyle, and that's our goal here at Scripps. And we're certainly here and happy to see you and talk about options.
Doctor, thanks so much. We appreciate you taking the time to be with us.
Thank you.
If you would like more information about knee injections versus knee surgery, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us.